My name is Roxanne, and my topic is cosmetic surgery. Cosmetic surgery is defined as surgery for improving a person's appearance by insertion of implants, removal of wrinkles, blemishes, etc. And is not to be confused with reconstructive surgery, which is used to help people have better functional lives by fixing birth defects. Today, cosmetic surgery is seen as a quick fix to a newer, better-looking you. While this may be true, cosmetic surgery is still surgery, and is something that is desired rather than needed. Insurance doesn't cover cosmetic surgery because it is seen as an unnecessary risk. Insurance providers put it under the category of elective surgery because it is harmful to the public's well-being. My first claim is that cosmetic surgery affects your health in a negative way, and my second claim is that cosmetic surgery affects you psychologically. Anyone who is undergoing surgery is at risk to serious side effects that can result from the surgery. One of the most common side effects of a cosmetic procedure is infection in or outside the area where the incision was made. Some other side effects include airway obstruction, blood clots, blood loss, brain damage, constant pain in the area, drop in blood pressure, hyperthermia, loose stitches, numbness, tingling, temporary paralysis, and even death. However, most of these conditions can be fixed by having another surgical procedure. It is reported that 1 out of 4 cosmetic surgeries will have some sort of bad reaction, according to the American Board of Plastic Surgery. In an article from CBS News, updated March 6, 2009, it reports of serious side effects such as seizures and difficulty breathing from the cosmetic surgeries performed. And in some rare cases, the side effects have resulted in death. In another article from the Salt Lake Tribune, updated April 17, 2009, a woman of 43 years of age was reported to have died in March, earlier this year, from what her medical examiner later determined was a silicone embolism in her lungs, which basically means that the silicone poisoned her lungs and caused them to fail. This was a result of a breast augmentation procedure she had had months before. Also, cosmetic surgery can become addicting and you can potentially develop psychological disorders from it. Psychologists are finding that often there is a heavy emotional and psychological price to pay for cosmetic surgery. Psychologists say 2/3 of patients who seek cosmetic surgery will return for another procedure. A well-known person who is addicted to plastic surgery, and many of you may know, is Michael Jackson. He has had more than 10 procedures performed on his nose alone, and experts from the American Journal of Psychiatry believe that he does this because he's never satisfied with the results of the procedures. Most people, like Michael Jackson, are clinically diagnosed with a psychological disorder called BDD, or body dysmorphic disorder, which is a condition where the patient has a mentality that their body is so distorted that no amount of surgery can correct it. This disorder requires professional help and therapy and cannot be fixed with surgery, even though most people with BDD tend to resort to surgery. Most people who are diagnosed with BDD and who choose to undergo cosmetic surgery are more likely to commit suicide because of dissatisfaction. In a study led by Thomas Cash of Old Dominion University, he found that after women have breast implants, their body image of themselves improves at least 1 year before they think lowly of themselves again. And he also found that 2/3 of women who had breast implants are more likely to think about suicide. He also concludes that the reason people become addicted to cosmetic surgery is because they only feel satisfied for a short while and want to continue having the feeling of satisfaction by continuing to improve themselves through surgery. In a study included from the Western Institute of Anxiety Disorders of 2000, 25 of the patients with BDD had a total of 46 cosmetic procedures because they weren't happy with the way they looked. This included 9 patients who even tried to perform surgeries on themselves when they couldn't afford it. 80% of these patients admitted to considering suicide if they couldn't reach their ideal image of perfection. When these patients underwent cognitive behavior therapy, 73.4% of these patients did not return to surgical procedures and were said to be content with their image. So in conclusion, cosmetic surgery isn't good for your well-being because you can suffer from serious side effects that affect your health, and you could develop psychological disorders and or addictions from it. So when people are considering getting cosmetic surgery, they should also consider the saying, if it ain't broke, don't fix it.
Right, well, the secondary claims were very clearly labeled. I thought the proposition was not very clearly labeled, but right at the very end in the summary you did come back to what that point was, so that helps quite a bit. However, when you get into the arguments, the structure, I think, breaks down, especially on the second point. We get into the issues about BDD and about addiction to it, and I'm not sure if those are supporting claims or if they're extensions of the main claim that you're presenting on that number 2 point, so it got a little confusing because the information tended to run together. I thought you did a very nice job, though, providing a variety of evidence. You had a couple of good examples to illustrate the points that you were talking about. There's some statistical data that applies to general plastic surgery issues, or cosmetic surgery issues, I guess I should say. There were some that were particular to BDD. Occasionally there was a little bit of overlap, and I wasn't quite sure. For instance, you had a couple of piece of information about the likelihood of suicide. It wasn't clear to me if that was stuff that was particular to BDD or to everybody who has cosmetic surgery, so I thought that was a little bit problematic. You did a good job, for the most part, citing your sources. There's a little too much reading and not much variety in your voice when you're delivering the speech, and like I said before, I thought the summary helped kind of recoup some of the problems that you had with the proposition at the beginning. All right, thank you.